Good morning. Good morning. I would like to thank the organizing committee for inviting me to present the nationwide database for the synchronous and metachronous head neck cancer and esophageal cancer. In English, which means the foreign speakers all have to speak English. Okay. Today, I think most of the audience already know there are very close relationship between the head neck cancer and the esophageal cancer. However, what is the magnitude of the risk in Asian people? So I think this is the first population case study in Asia. We accumulated a lot of head neck cancer patients and the esophageal cancer patients, and I think the database, the big data is sufficient to show you the incidence and the risk of the relationship between these two cancers. Okay. I think head neck cancer. Usually when we say head neck cancer, usually we're talking about the oropharyngeal cancer, and including the oral cavity, oropharynx, and hypopharynx, and the nasopharyngeal cancer and laryngeal cancer. And head neck cancer is the sixth most common cancer in Taiwan, and also ranking fourth as the cause of cancer-related mortality in men. And second cancer is prevalent in patients with head neck cancer. And I think everybody knows second esophageal cancer and second lung cancers are the most usual sign. And usually the prognosis is very poor. Okay, I think the first issue is what is the incidence, risk, and also the survival impact for the patient with head neck cancer who developing the second esophageal cancer. So we will categorize the head neck cancer into the oral and pharynx, nasopharynx, and laryngeal cancer. First of all, we use the Taiwan Cancer Registry database, and we already included 63,000 patients with head neck cancer. And the cancer coding of multi-primary follow the rule of IACR and IARC. So we will calculate the risk of second esophageal cancer in a patient with head neck cancer, and we will also look at the incidence and risk in relation to their primary tumor site. Okay, the primary index tumor site. I think we have 33,000 cases with oral and pharyngeal cancer. And we also have 23,000 nasopharyngeal cancer cases, and also 6,000 laryngeal cancer cases. I think this is a big data. All right, with 63,000 patients with the first primary head neck cancer, we can see the number of the patients who develop any kind of second primary in the oral and pharynx is around 7%, but the who developed the esophageal cancer is only 0.5%. But in the nasopharyngeal cancer case, I think the second esophageal cancer only 0.4%. And for the laryngeal case, and the second esophageal is 0.7%. Right? But this is just the incidence rate. But if we are talking about the risk, to calculate the risk, we use the standardized incidence ratio. This is the SIR. SIR was taken as a ratio of the observed number of second cancer, and then to the expected number. And this SIR, the risk has been adjusted by the age, also by the gender, also by the calendar year. Okay. The SIR， 它的意思就是说，这个人得到这个 second esophageal cancer 是正常人的几倍，这个意思。 bilingual. Okay, so we can find among all these head neck cancer patients, the risk of second esophageal cancer. So if you look at the oral and the pharyngeal cancer case, the risk is 8.7， 就是8.7倍的意思，正常人的8.7倍 compared to normal people. Alright. And for the nasopharyngeal cancer case, so the risk is equivalent to the normal population. Alright, it's not higher. But for the laryngeal cancer case, the risk of second esophageal is also higher than normal population, and it's about 4.64. But if we divided the oral and the pharyngeal cancer into the three index sites, the oral cavity, oropharynx, and hypopharynx, and then we can find the hypopharynx is the primary site which have the highest risk for second esophageal cancer. I think this is very compatible with our clinical experience. So the hypopharyngeal cancer patient has 22-fold. I mean, in terms of the risk to developing the second esophageal cancer. And if we look at the age onset and the interval, the age onset of the average age of the oral cavity cancer is about the 50s, right? You can see in Taiwan. I think this is around the middle age. And also the average age and diagnosis of the second esophageal cancer is also around the 50 to 60. And so the average interval between the first primary and the second esophageal cancer is about 1 to 5 years. So I think the first 5 years is the period that we need a cross surveillance. The average follow-up is about 3 years. So if we calculate the risk according to the follow-up interval, and we can see the first year we have the highest risk to develop a second esophageal cancer. But this means actually the first year we have many cases are synchronous. So that's why you see the risk is the highest in the first year. But the risk remains very high between the first to fifth year, right? So when we develop the follow-up program, I think the first 5 years are very important. Age trend, yeah. The youngest patient have the highest risk to develop a second cancer. We can see the age below 50 is the highest age for oral and pharyngeal cancer and also for laryngeal cancer. Talking about the impact of survival. This is the median survival of the cases in Taiwan. The oral and the pharynx cancer, the average median survival is about 4 years. But if we look at the laryngeal cancer, it's about 10 years. So this is a very, the cancer with a good prognosis. And for the nasopharyngeal cancer, it's about 7 years, the median survival in Taiwan. The cumulative incidence of second primary cancer, if we follow up longer, we can see the hypopharyngeal cancer actually have a higher chance to developing the second primary esophageal cancer compared to the oral cavity. But if we do the Cox regression analysis, we can see for the patient without second cancer, they have better survival prognosis compared to the patient who develop second esophageal cancer. So this means that the second cancer actually have a negative impact on survival. And once the patient developing the second esophageal cancer, we can look at the survival is very poor. This is the data based in Taiwan. It's less than 1 year, okay? So second, esophageal cancer has very, very poor prognosis. Look at the overall survival. If we compare the patient who developed second esophageal cancer versus other second cancer, I mean the non-esophageal second cancer, we can see second esophageal cancer has a poor prognosis compared to other second cancer. Okay, now we can see the same trend in oral cavity cancer, oropharyngeal cancer, and also hypopharyngeal cancer. So second esophageal cancer has the poorest prognosis compared to the other second cancers. And also compared to the primary esophageal cancer, and we can see the survival. This is the survival in the primary esophageal cancer patient. But this is the survival curve in the patients who develop second esophageal cancer. So from all this data, we know that the second esophageal cancer really has very poor prognosis. This is a short summary. So from the data, we can see that second primary esophageal cancer is an important issue in the head neck cancer, and also had a great impact on survival. But in the nasopharyngeal cancer, we didn't see the risk of esophageal cancer. I think this is because nasopharyngeal cancer in Taiwan has distinct etiology. It's EV virus related, right? It's nothing to do with tobacco and alcohol. So when we developing the program for the cross surveillance, I think we should consider the first 5 years is a very critical period. And now, another issue is, what about the patient with primary esophageal cancer? Do they also have higher risk to develop second head neck cancer? So, I mean, I call this reciprocal relationship. Right? So, to answer this issue, we also use Taiwan Cancer Registry. We include 16,000 patients with diagnosis of first esophageal cancer. And we also calculate their SIR. And we can see among the patients with the first esophageal cancer, and they also have higher risk to develop the second primary, the oral and pharyngeal cancer. And we can see the same trend. The hypopharynx is the most, the second primary site with the highest risk, right? The follow-up interval, and also within the first year, we can see the highest risk. I think this is because there are many patients with synchronous cases. For the patient with the first esophageal cancer, we can see the patient has a 31/4 in terms of the risk to develop a second hypopharyngeal cancer. And age trend, we also see the youngest people have a higher risk. So how about the survival? All right, for the second oral cavity cancer and second oral cavity cancer and second oral pharyngeal cancer has better survival compared to the second hypopharyngeal cancer. So hypopharyngeal cancer has the shortest survival. So therefore, the summary of my talk today is look at this picture. I think we have a sufficient data to show that there is a bidirectional relationship between the oral and pharyngeal cancer and the esophageal cancer. So I think there is a strong association of the first primary oral and pharyngeal cancer with the second primary esophageal cancer, and vice versa. In which both had a very great impact on survival. So we should develop a follow-up surveillance, especially for the high-risk patient. I mean, the young people, I mean, the hypopharyngeal cancer, these are all the very high risk group. And I think today's symposium is very important to help us develop a strategy, treatment strategy to treat this multiple cancer. As we can see, the overall survival is very poor according to our nationwide data. Okay, so I will acknowledge the second malignancy study team in Chang-Gung Memorial Hospital in Chiayi. And also I would like to thank the Biostatistics Center from the Chang-Gung and Chang-Gung University. And I also present this data because I'm also the team member of the esophageal cancer core major group. So we use the database from the Taiwan Cancer Registry in the National Department of Health. Thank you for your attention.